Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Do subscribe to our YouTube channel. You can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Two Talk, I have Dr. Saravanakumar. To give you a brief introduction about Dr. Saravanakumar, Dr. M.S. Saravanakumar received his master's in Pedodontics and Preventive Dentistry, that is MDS, from the College of Dental Sciences, India. He was the best outgoing student in his MDS with the university rank holder from the Rajiv Gandhi University of Health Sciences, Bangalore. He completed his standard proficiency in lasers from IALD, LEI, and UCSF, and advanced proficiency from ALD, WCLI, and the Manipal University. He has been honored with a fellowship award, ISDR, Pedo Master Excellence Award, American Diplomat, and the Fellow ICT. Dr. Kumar is a senior consultant in the Chennai Apollo Hospitals. He is one of the first persons in India to initiate laser-assisted pediatric dentistry. He has to his credit several national workshops and symposiums. He owns India's first exclusive tongue-tie clinic in Chennai, India, and with his team serving the needy infants and children. He is the first pediatric dentist from India to be recognized as a tongue-tie specialist and has been elected as a committee member in the International Association. He has served as an adjunct faculty of the UDV, Andorra, and Dubai. Dr. Saravanakumar, thank you so much for joining me in today's Two Talk conversation.
Thank you, Dr. Rekha, for a wonderful introduction. And at this juncture, I pray God that everyone stay home and take care of this global crisis, COVID-19. That is the request, and I wish everything will be fine. Thank you.
Yes, thank you so much. So Doctor, you are a specialist in what we call as tongue tie. So, what exactly is tongue tie? Will you please tell our patients what a tongue tie condition is?
Yes. Normally, the tongue below the tongue there is a frenulum. As a dentist, we all know there is a labial frenum, lingual frenum, and there is a buccal frenulum. So all this frenulum by nature during the embryologic stage, it has to go apoptosis. The cell death, programmed cell death has to happen so that the frenulum frees off the tongue or the attachment so that the tongue will be free enough to move. Tongue tie means if this frenulum is short, tight, and if it is restricting the movement of the tongue, then we call it as a tongue tie. So mainly tongue is one organ. Yeah.
So doctor, frenulum I think is a very technical term. So if we have to tell our patients what a frenum is, it is probably if we lift our tongue, the patients will be able to see a thin strip of skin that connects the skin, that connects the tongue with the rest of the mouth. So that is the frenum that we are talking about today.
So the thin tissue below the tongue, which is connected between the tongue and the tissue, if it has to be long and elastic. If that tissue is short and tight, the movement of the tongue is restricted. So that leads to something, a condition called as tongue tie. So the tongue is tied because of this tight frenulum. So it is not going to allow the tongue to do its function. In that way, the issue starts. That is what is called as tongue tie.
So, doctor, this is a condition that parents will be able to detect in the child when the child is born. So, what are the kind of differences they would notice from a normal child as opposed to a child with a tongue tie?
Yes. Newborn screening. Normally, the newborn screening, they do a lot of screening, hematological screening, and everything, and they check for the movements of the eye, ear, and other things. The tongue, the tongue is tied or not, the parents themselves can examine and check only if they see the baby while baby is crying. Only there is different types of tongue tie. Only the anterior tongue tie, that is class 1 tongue tie, it will be easily seen, and it can be diagnosed by the parents themselves. And other type of tongue ties, it's very difficult to diagnose. Only the will be able to diagnose it based on the symptoms. So one important thing I like to stress here is mainly anatomical. The physical appearance alone is not the diagnosis. The functional part is very important. Based on the symptoms, what their parents tell, we have to come to a diagnosis.
So,
So
so
that is
what
one part I want to
exactly,
discuss.
what exactly will the mother or the father notice is different in their child? Like in terms of, if it is an infant, obviously an infant is not talking yet. He's not doing any other activities. So probably, feeding, breastfeeding is probably
Mm.
the first thing that the infant does. So is it possible to make out at this stage itself?
Yes. So, in my experience of this 10 years, no, what I have found is there are different situations when they come for to check their babies having a tongue tie or not. Mainly when there is a breastfeeding problem, when there is a tied tongue, no, it doesn't allow the tongue to do its function. So there will be a breastfeeding problem. The mother will have a painful nipple, and they will not be able to feed the baby properly, and weight gain is less. So these are the complaints what normally the parents come with. And as a professional, it's a teamwork. So what we do is normally we tell them to go and meet a lactation consultant who help them in telling them the different positions how it is going to improve. And if I diagnose it right away, then I'll tell them to go for the tongue tie release. Or if it is a thing where we have different types, and we want them to go for the lactation consultant and get an opinion, and then they can come back for the tongue tie release.
So generally, doctor, in your experience, what is the age group that you generally perform? Suppose a surgery has to be done to relieve this tongue tie condition. What is the age group you generally recommend that this surgery happens at?
Hmm. Yeah, a very good question. Actually, many parents, they wait and they tell that a lot of a lot of medical professionals still they don't know the importance of this impact of tongue tie on the whole life. It doesn't mean that everyone should know everything. So everyone, like we as a professionals, we be more specific on certain field of interest. So many pediatricians, they don't address this importance of tongue tie. So the age, many parents will wait and they tell that my pediatrician or my dentist told we can do at the later stage after 2 years or 3 years. But in my experience, what I have learned from the other experts is you have to treat this tongue tie as early as possible. For example, a lot of parents, they tell first few weeks I didn't have a feeding problem. After that, I'm having a feeding problem. And if we diagnose there is a tongue tie, we'll tell them it's because of this after getting an opinion from the lactation consultant. But they will ask me why first 1 or 2 weeks I didn't have a problem. So there's a lot of hormonal changes. The body prepares before the child is born. The body prepares, and there is a preparation of mother feed already done. So that will be supplying during the first 1 or 2 weeks. But after that, the baby has to work hard with the tongue to move the milk from the breast. So that time, the role of tongue tie plays important. So as early as possible, we'll tell them to do. Normally, I do after 7 days. Within few months itself, we tell them to do it, because first few days I allow the natural process to take, natural urge for the baby to crawl and search for the breast and take the milk. After that, we go for the tongue tie release. So it is as early as possible, because every day the brain develops in a faster stage. So we don't want the brain to get
Yes.
we do. What is the problem in doing a later stage is, when we do at the later stage, the child takes more time to uninstall the program and reinstall the released tongue. So it is difficult for them to learn the pattern of tongue movement. Yeah, that is one thing. So as early as possible, even within few days or few months, we can do it. That is the protocol we follow.
Okay. So I think considering the surgery you recommend is for almost like a newborn child, I think parents would be a little apprehensive about how the procedure would be. So is it a very lengthy procedure? Is it are there going to be any complications post surgery? I think these are some of the things patients will want to know. So doctor, what would you tell them about the procedure of the surgery?
Yes. Normally, how we go is first, when we get a phone call, we ask them the details, where the child is born, what is the weight of the baby, whether it's a preterm baby, what is the problem, symptoms. We do a phone consultation, and then we'll ask whether they want to come for a consultation or for the procedure. Because most of the times, the parents, they mainly come for the symptoms, and they travel quite a lot of kilometers. So they come for the procedure. Other parents, they ask for the consultation. So when they come for only consultation, we tell them the degree of restriction, the range of motion of the tongue, and we show them how the tongue restriction is affecting their feeding. And then they take an appointment, and then they come for the procedure. And the procedure wise, procedure as such, is very, it's not a dental chair, it's a table. We put the infant, swaddle the infant, and then we'll do it with the laser or with the scissor, based on the parents requesting. The tools, different tools are there. Only the operator competency, how proficient he is very important, and more than the tool. That is what we believe. So the procedure is a very short procedure. It takes only few seconds or few minutes, 1 or 2 minutes. But preparing the parents mentally and physically, it takes long time. So I spend nearly 1 or 2 hours in talking to them, explaining them everything is fine. Then the procedure will be done only for 1 or 2 minutes. It's just like giving a vaccination. So immediately the child will be crying, and the child, we have a lactation feeding room, so we allow them to feed there. So the procedure wise, it's very less time, 1 or 2 minutes, but preparation is 1 or 2 hours to
Yes.
them to understand.
Yes.
We have to tell them what are the things to be taken care, and post operatively we'll tell a lot of things how to come for the follow up visits.
Instructions. So, doctor, in your experience, what do you think is the prevalence, or how common is tongue tie in India?
Yes, in India there are a few studies which have been published recently. They tell there is a more incidence of tongue tie, because earlier studies, whatever they have done, they were not having a proper diagnostic criteria. They were not able to find out the tongue tie, which is only class 1 they are able to find out. So the incidence rate was like less, like 2 to 3%. But after that, when they come to know there are different types of classifications, and now overall globally, there is a incidence rate of 10%. So that is what we are seeing. We see that tongue tie is like around 10% incidence rate.
Okay. Doctor, one more thing I would like to ask. So, just in case at some point, the parents miss out that their child has a tongue tie at the initial stages, and the child has probably grown to be a little older. So, what are the kind of symptoms you could possibly see in an older child? Say, in a child who was already supposed to start talking, start eating, and things like that. So, what are the kind of symptoms that they can see in an older child?
Yes. Good. Very happy to answer this question because a lot of parents they don't have a feeding problem at all when there is a tongue-tied baby because we call them as a super mom or super baby because humans have superpower. So the baby is doing very good work or mother is having a very talented way of feeding. So they will not see any feeding problem at all. In future they might come for the speech problem. The child is not able to pronounce certain words or letters where the tongue has to touch the alveolus, dentoalveolar sounds or certain sounds which tongue will not be able to pronounce. This is one place where I see the parents come for the release of tongue tie. And other thing is the child will start pouching the food and they will not swallow because tongue is not moving. Tongue is not moving enough. They will not be able to swallow. So they will be pouching the food in their cheeks, and this is one condition. And in future they might get dental caries because they are not swallowing properly. So because of food pouching there, they get dental caries. Then there are certain areas like where the tongue might affect the breathing, and palate is one thing where if there is a tongue tie, the be constricted, and that will have an effect on the breathing, anterior airway. On the upper airway, they affect the breathing, so they have a breathing problem, sleep problem, chewing problem, speech problem. So it is all somehow related with the content. So these are the
So,
problems with.
so even in an older child, once the tongue tie is released, do you think the child will be able to go back to doing his normal activities properly like any other normal child?
Yes, yes. But as I told you, it takes some time for them to program themselves with the released tongue because they were trained with the tied tongue. So it takes some time for them to. So that is the area where orofacial myology exercises like physiotherapy. If there is a fractured limb, if your hand is fractured, you are using that hand for a long time, but again, once your hand is fractured, they need a physiotherapist to tell you how to move your hand. It doesn't mean that you don't know how to move, but it takes time. So same way, when there is a tongue tie, if you release it, it takes time for them to understand and chew properly and learn.
With an interdisciplinary involvement in this whole thing, the child will be able to get back to his normal activities and be able to resume his normal activities, his day-to-day activities in a proper way.
Definitely.
Dr. Saravana, you are based out of Chennai, so you would be doing your procedures there. So, which other part of India has this kind of facility available?
Yes, now I see like now few ENT and few people are more knowledgeable on this. Mainly pediatric dentists, they learn a lot of things on this, and they are able to do in their practice. Like I'm seeing a lot of people in Mumbai, Delhi, and in Tamil Nadu, Coimbatore. A lot of people are doing this. Only thing is they should have a high standard of proficiency in the tool what they are using with the skill of the operator, and that plays a very important role in the prognosis, the baby's outcome. The
Yes.
success rate is very once they understand the protocols.
Okay. Okay. So, Dr. Saravanakumar, thank you so much. That was a very informative talk on probably people don't even realize and understand, sometimes because they have no knowledge about this particular condition and how much trouble it can possibly cause their child. So that was a very informative talk, and I hope our patients will be able to learn and understand something from this talk.
Thank you. Thank you
So,
very much.
yeah. So thank you so much for joining me today. And I hope
wish we do more.
I hope I'll be able to get you back for other topics that you deal in pediatric dentistry.
Thank you. Thank you.
Thank you so much. Thank you. That was Dr. Saravanakumar, who did talk to us about a condition called tongue tie. I hope that was helpful to all of you. If you have any doubts or queries, please do leave your questions in the comment section below, and we will get back to you on that. For more information about your dental health, do visit our website www.thedentaire.com. Subscribe to our YouTube channel. You can follow us on Facebook, Twitter, Instagram, and on Telegram. And the contact details of Dr. Saravana is given below in the description box. So until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.